Welcome to November's Digital Team Brief. I recently shared some important news with you. In that, I have been asked to provide leadership support to Stockport NHS Foundation Trust for the next 12 months. This started on the 9th of November, and I want to reassure you that during my secondment to Stockport, I will remain the Chief Exec here at Tameside and Glossop. This is an opportunity for us to share the learning from our integrated care approach with Stockport. Trish Kavanagh, our Chief Operating Officer and Deputy Chief Executive, will take on additional day-to-day duties on my behalf during this time. This partnership working with Stockport reflects and recognises all the good work we have undertaken in Tameside and Glossop and gives us the opportunity to share with our neighbours in Stockport the learning from our journey here, as we hope to learn from some of the changes they have made to improve over the last few years. We should also be very proud of our achievements we delivered in Tameside and Glossop, embracing new ways of collective working to best meet the needs of our patients and our public. This is an opportunity for us to share the learning from our integrated care approach with Stockport, working together in partnership. Our flu campaign is going from strength to strength. More than 78% of colleagues have had the flu vaccine so far this year. This is a fantastic achievement with a few months left to go to the campaign. If you've not been vaccinated for flu, please look at our TIS page to book a vaccination. If you have had your flu vaccination with your GP or through your local pharmacy, please tell the occupational health so that we can record it. Speaking of vaccines, we've recently received some very encouraging news that the first vaccine for COVID-19 is in the very final stages prior to rollout. We don't know exactly when it will be available, but as you may be aware, we are expecting to receive the COVID vaccine in the very near future. I would urge you all in the meantime to have a flu vaccine to ensure that we can be prepared as possible. Although a vaccine for COVID-19 is now very close, we must continue to do the basics, maintaining a 2-metre distance where possible, sanitising or washing your hands as often as possible, and wearing a suitable face covering remains the best way to protect yourself and others from contracting COVID-19. For your safety and the safety of others, all staff required to wear a blue surgical fluid repellent face mask at all times during their working day. Please also ensure that masks are changed when entering and leaving clinical environments. The COVID-19 vaccine is going to take time to roll out, and with that it means that we must remain extra vigilant for the foreseeable future and beyond. I am pleased to update that our rollout of rapid staff testing has got off to a good start. We begin the distribution on Wednesday the 25th of November, and we are now working through distributing thousands of kits to our patient-facing staff. If you are a patient-facing member of staff, you will receive a text message over the next few weeks inviting you to collect your test pack at a specific location and time. With this in mind, please make sure that your mobile phone number is up to date on ESR. So that's the number that we'll be using to text you the details. As you know, the test is very quick and easy. It takes just 30 minutes to get results, which you can do at home. And we are asking staff to do this twice a week. We have also developed an app to record the results, and those details will be provided in the next message you receive about picking up your pack. With this testing breakthrough and the imminent COVID-19 vaccine, I really can see a cause for optimism, and I think if we continue to do what we are doing, we will hopefully be in a much better place come April 2021, and hopefully we can look forward to getting back to the way things should be. I'm really pleased to report that the Scanner Fund is now standing tall at over 83,000, which is fantastic news. If you haven't already purchased one of our trees, there is still time to help offset your carbon footprint by reserving one, which were kindly donated to us by the Woodland Trust. The idea is that individuals and organisations can make a donation of any amount and sponsor a tree in support of our scanner appeal. Our head of fundraising, Kate Ledbetter, is taking orders and can organise collections. You can email Kate on using the email address on screen now. Thank you for watching, and I will be back with one more briefing in December before the end of this year. Thank you.